Wonderful. So I will get started. 6:02 is my typical time that I do get started. I'm a bit of an A-type personality. Oh, welcome, Siraj. I can see there that you're from the northern suburbs. Wonderful. So we've got a little bit of variety there, just from the few who've popped their suburbs into the chat box. Thank you for doing that. It really helps us to understand where people are zooming in from. So what I'll do is get started on the presentation for this evening. What we hope is that you arrive this evening maybe not knowing much about foster care, and that you leave at the end of our hour or so together knowing much more than when you arrived. So that's what we're aiming to do for you this evening. So before I do get started on the content, it's very important that I just acknowledge the traditional custodians of the land that we're all meeting on today. And I would like to pay my respects to elders past, present and emerging on all of those lands. So obviously, because we're all joining from different places around Melbourne, that will be different traditional custodians represented. I'm on the land of the Wurundjeri people here in Ascot Vale, so I would like to recognise and acknowledge their elders past, present and emerging. So tonight you'll be listening to my voice a lot, so I do want to apologise in advance about that. I know it's probably not the most pleasant voice to listen to. My name's Hannah, and I am the carer practice manager here in Victoria. So my job is to oversee the team who lead all of our recruitment activity for new carers and our assessments of new carers, and the very fun part, the accrediting new carers. That's the part we really love. So that's my job, and I'll be speaking to you for tonight. And I do have my trusty sidekick, Louise, here. Lou, did you want to say hello to everybody there?
Oh, hi guys, welcome to our presentation. I hope you're all well. Yeah, I'm the Carer Engagement Officer for Life Without Barriers. So if any of you wish to proceed after tonight and you click the link, then after your screening, I will be the one that will be walking you through the process next.
Lovely. Thanks, Lou. And Lou's underselling herself there. She's a wizard. She's tremendous at helping people through the process and absolutely wonderful at answering questions. So you're in very safe hands with Louise. So a little bit of housekeeping for tonight. As I mentioned before, we really rely on that chat box for you to ask questions and to have a two-way dialogue with us. So if you have any questions throughout the presentation tonight, please do pop them into that chat box there, and I do promise I'll get to them at the end of the presentation. The thing I'd sort of add there is just for very personal or private sort of specific questions, we can always speak with you privately afterwards as well. And at the end of the presentation, I'll give you some options about how you can continue the conversation privately about yourself and your family and your household. So just a couple of things there. A quick overview of, I suppose, where are we headed tonight? What's the roadmap for this evening? Really, what we're going to do tonight is focus on some of the questions that we hear all the time from people who are really keen to find out, is fostering a good idea for me? So that's what we'll be focusing on this evening. So some of the areas that we're going to explore together tonight, there are lots of them, but I promise it won't take that long. Firstly, who is Life Without Barriers, which is the agency Lou and I work for, and you'll hear me sometimes refer to us as LWB throughout the presentation as well, just a word of warning. We'll also talk about what foster care is. It's pretty important if you're applying to be a foster carer that you understand clearly what that means. We'll talk about where foster carers are needed, and I'll give you a hint, it's everywhere. We'll talk about the different types of foster care. There are different types of care. It's important you understand those. We'll talk about the children in care and some of the stories from care as well, from carers and from children. We'll talk about who can be a carer, and hopefully by the end of this evening, you'll start to understand that you can probably be a carer. We'll then talk through some frequently asked questions. These are the ones that Lou and I get all the time from people who are wanting to be foster carers. So we'll answer some of those. Then we'll come to your questions in the chat box as well. So if you think of anything throughout the presentation, please do pop it in there and we will get to it. And then the last thing we talk about together is where to from here. So tonight is the first of what we hope will be many conversations that we have with you about foster care. In the conversations after tonight, you will do more of the talking instead of me. So that's really where we're headed this evening. That's what we're going to look at together. So let's get started. So firstly, let's talk about who Life Without Barriers is. So we're a pretty ginormous leading social purpose organisation working all across Australia. So we work in more than 440 communities, and we do work in a number of different areas, which I'll talk a little bit about now. So obviously you're here with us tonight listening about foster care. So that's a really big part of what we do. So we run child, youth and family services all around Australia, including here in little old Melbourne. We also work with people with disabilities and with refugees and asylum seekers, and with Aboriginal and Torres Strait Islander peoples all around Australia as well. So that's just some of the work that we do nationally here at Life Without Barriers. Obviously, the foster care team sits within this nice pink, that's our branded colour, child, youth and family space. So what is foster care? So really foster care is for children who need time away from their family, and it gives them an opportunity to stay in a safe and supportive home where they can start to heal and grow. So healing from their traumatic experiences. Foster care might be for one night, it might be for 1 week, it might be for a year, it might be for 10 years, it might be for anything in between that as well. But at the heart of it, it's really important that you understand that foster care is temporary care. And in the state of Victoria, the aim is always to reunify families or put families back together where it's safe and appropriate. So that's what we really try and focus on doing. At any given time around Australia, there are around 50,000 children who are unable to live safely at home, which is a pretty staggering number to think about it. And we'll look a little bit more at some of those numbers in a second. So where are more foster carers needed? The simple answer is everywhere. And I can absolutely tell you across every suburb in Melbourne, there are foster care placements needed and we need carers. Around Australia, though, this is a little bit what the picture looks like. So you can see that there's a number of children in foster care and relative or kinship care in every state around the country. In Victoria, the numbers are interesting. As I mentioned before, Victoria's policy is to try and keep families together and reunify them where they can. So you'll notice that our number of children in foster care, which is around 1,500, is different to our number of children in kinship or relative care, around 7,000. So when we say kinship or relative care, we might mean the child maybe can't live with their mum or dad, but maybe they can live with grandma or a cousin or an auntie or an uncle. And that's a real focus in Victoria, is trying to keep children with family where it's safe and appropriate, and we're able to do that. So let's talk a little bit now about the different types of care. There are different types and different people apply for different things. So it's important you have a bit of an understanding of this after tonight. So there's 4 different care types we'll talk about. So respite care being the first one. So respite care is usually planned in advance, and it's typically a weekend or maybe a week during the school holidays. It's anything up to 7 nights in a row, respite care. What respite care does is provides full-time foster carers with a break. So if a long-term carer, for example, has a child in their care and they've been invited to a wedding, lucky them, but unfortunately the wedding doesn't allow children there, so they need somewhere safe and appropriate for the child to go, they will pop them into respite care for that weekend, is something they might do. So it provides those carers with a break. The other thing it does, which is really nifty, is it gives children the opportunity to mix with different social networks, eat different foods, stay at a different house, and develop the idea that there are lots of adults in their life who love and care about them. So that's a really nice thing about respite care as well. The next care type over here is emergency care, which is a little bit the opposite to respite care. It's definitely not planned in advance. It's really immediate care, and it's where children need somewhere to stay right now. So the call for emergency care might come at 3 in the morning, at 3 in the afternoon, or any hour in between those. Emergency care is anywhere up to 4 weeks at a time. So really we're looking to place children somewhere safe and appropriate while we sort of figure out what the longer term plan is. Then down here we've got short term care. So this is anything up to about 6 months at a time. And it's often the care type that children are under when something particular is being sorted out at home. So maybe mum has a mental health concern that she's really needing to address urgently. And once that is sorted out, if it's safe, then the child will go back home. Sometimes short-term care is needed while longer-term plans are made for the child as well. So maybe we're looking at finding a family member, another family member that they might be able to go and stay with, but there's some planning around that that's needed. So we'll pop them into a short-term foster care placement while that occurs. Regardless of the length of care, like all care types, short-term care needs to feel safe and stable for children so that they can heal and they can build their relationships with their family, so that if they do end up going back home and being reunified, it goes really well. We want it to be successful. Then over here, we've got long-term care, which really is anything 6 months and above. So that's what we're talking about there. Long-term carers really make a commitment toward supporting children into adulthood. It focuses on stability for the child, and long-term care might be forever, but it might not as well. So it really just depends on the child and their circumstances. So that's a little bit about the care types there. And obviously, when it comes to fostering, every child is unique. No two children are the same, no two families are the same, and so no two placements are the same. Some of them are needed for one night, some of them are needed for 1 year. It really just depends on the needs of the child at that particular time. So let's talk a little bit now about the Life Without Barriers approach to foster care. So here at Life Without Barriers, the work that we do every day with our foster carers and the children we support is underpinned by an evidence-based therapeutic model of care, which is very easy to remember the name of because it's called CARE. And it has 6 principles that really help us and guide all the work that we do that I'll just give you a nutshell explanation of now. So CARE is firstly relationship-based. So it recognises that children need trusting and meaningful relationships with adults who care for them, because that helps children to build their emotional and social confidence. And that serves them well when they're children, but also well into their adulthood as well. It also is developmentally focused. So CARE recognises that strategies for change are most effective and most likely to work when they meet the children where they are at. So we want to challenge children appropriately, but we don't want to overwhelm them and make them feel that they're not capable. So that's really important. CARE is also trauma informed. So it ensures that we're always considering the impact that trauma can have on a child's development. And as the adults in the situation, recognising that carers need to modify our expectations and our interactions accordingly so that we can respond really well to the child. It's family involved. So again, it recognises that children's identity is tied to family, community and culture. And so no matter where they're living or what kind of placement they're in, it's really important that those things are being promoted and the child is remaining connected to family, community and culture. It is competency centred. So it recognises that children need to be supported to develop skills, skills for childhood, but also skills that are going to serve them well throughout their lives as well. So the things that they're going to need to negotiate everyday life. And it's also ecologically oriented. So it recognises that the environment in which children are raised and the role models they have around them when they're raised play a really significant role in how they develop and grow. So that is a very, very simplified, very nutshell explanation of the CARE approach that guides the work that we do at Life Without Barriers, and hopefully gives you a little bit of an overview or an understanding of how we work. So let's talk now about children in care. I think this is the part people are most curious about when they come to an information session. So before I start in on the slide, I'll just draw your eye over here to Kieran on the left-hand side and his very handsome dog. So Kieran has a full-time job and he's excited about plans to buy a house in the future. And he came into foster care when he was 12 years old. So he's obviously aged out now. And he remembers that his foster carer has played a big part in who he is today, which I think is a really nice way to ground what we're talking about here. So there's lots of different reasons why children might come into care. They come from all cultures, they come from everywhere across Australia, and each child has a unique set of circumstances and a unique story. What sort of bonds them together is that they all come from very complex family and social situations, and it's very likely that they've suffered neglect, trauma or abuse in those situations. So children in care are aged between 0 and 18. They come from all cultural backgrounds, as I mentioned. They all have families who they love and who are important to them. And they've all suffered trauma of some sort. So just being removed from their family of birth can cause trauma for children. Some children have been abused in different ways. That might be physical, emotionally, or sexually. And others have witnessed horrible things happen to the people they love, which is obviously an incredibly upsetting and confronting thing for little people to witness. So the other thing that we see quite commonly for children in care is that they've experienced neglect. And what that means is they haven't been given the care and support and supervision they need to grow and develop age appropriately. So those are some of the things about what we see coming through with children in care. So obviously, with all of those challenges that we've just talked about there, we need carers with attributes and beliefs that we know are good for children so that we can help them to heal and grow from their experiences. So here are some of the stories of some of our carers and care leavers at Life Without Barriers. Over here, we've got Gary and Shell. Excuse me. So Gary and Shell provide long-term care for 6 to 11-year-olds. They live on a farm in Tasmania and they have 3 adult children that they've raised up. And now they have 5 children in their care. So 5 siblings all related to each other. And Gary and Shell have made the commitment to keeping those siblings together under one roof, which I think is just phenomenal. So that's one type of carer that we see, the long-term carers there providing care for siblings. The next story is about Stacey, who again isn't a foster carer herself, but she was raised in foster care and she's now studying at university to become a social worker. And she talks about how important it was that her foster care family made her feel part of their family, which I think is a really important thing to hold on to. Then we've got the lovely Belinda over here on the right, who provides short-term care for 5 to 18-year-olds. So Belinda's a single carer and she works full-time in a very demanding job, but she really wanted to be a foster carer, so she made it work with her lifestyle. She started doing respite and emergency care on weekends, then extended out to weeks, and now she provides short-term care for children within those age groups. You'll notice there's a little read more sticker at the bottom of these stories. It doesn't work on this presentation for you, but I do encourage you to pop over to our Life Without Barriers website and you'll find these stories and many, many more. They're wonderful stories, they really are, and they bring to life a lot of what we're talking about here tonight. So I do encourage you to have a look. So, having heard a bit about some of our carers, who can be a carer? It's likely that you can, and we hope by the end of tonight's presentation you learn that you can. So carers can be married, single, they might live with other people, they might live alone, they might be divorced, they can be from all backgrounds and all cultures. Really, all of that is secondary to us. What we're really interested in is your ability to care for and nurture a child and keep them safe. So there's a few eligibility criteria that you do need to meet in the state of Victoria to be a carer. So you must be over 21 and you must have relevant life experience. And what we mean by relevant life experience is you need to have met and interacted with a child before. That's probably a good place to start. You do need to be well and healthy because the role of a foster carer can be quite demanding. So we need to know that you're physically okay to cope with those demands. You do need to have a regular source of income. Foster care is not a get-rich-quick scheme. I'm here to break hearts if that's what you thought it was. It is really important that you're already financially stable when you step into the role of foster carer. You can be from any cultural background. You might be single or in a relationship or married or de facto. You do need to be willing to undergo background checks. And what we mean by that is things like police checks and working with children's checks. So we have a responsibility to make sure that we're placing children in safe homes. And that's a really important step for us to make sure that that's what we're doing. So a little bit about your home and your family. So you might have children or you might not. That's totally fine. You might rent your home or own it. Again, that's completely fine. You do need to have a spare room in your home, which is where the child will stay and sleep. You do need to have a car and a license so that you can drive the child to appointments and things like that. And everyone in your home does need to be willing to participate in the assessment process to some degree. And I'll talk a little bit more about that in detail very shortly. So that's a little bit about the eligibility criteria and the things we're looking for in applicants. So let's move now to talking about frequently asked questions. So some questions about you as a person. We get this one all the time. It surprises me that this myth is still out there in the community. I'm single, can I be a foster carer? You absolutely, most definitely can. In fact, about half of our foster carers are single people and not in relationships. So families come in all shapes and sizes, so our foster families have to as well. Absolutely. The same with this one as well. We're a same-sex couple. Can we foster? Yes, with an exclamation mark. That's how much we mean it. You absolutely can be a carer. And again, whether you're single, married, in a de facto relationship, same-sex attracted, honestly, all of that stuff is really secondary to us. And we just need to know that you're a safe, appropriate person who can provide that love and stability for a child in care. I don't have my own children. Can I be a foster carer? Yes, you absolutely can. So what we do when we conduct an assessment with a foster carer applicant is we look at the skills that you already have around caring for children, and we look at areas where you might need further development. And then from that assessment, we will also make recommendations about the ages and needs level of children who would be most appropriate to place with you as well. So that's a little bit about the assessment process, but absolutely you can be a carer if you don't have children of your own. Just a little checklist we like to put up here about what great foster carers have. So there's things like patience, understanding, acceptance and availability. Commitment is a big one, flexibility, time, and a commitment to maintaining and strengthening family relationships for children in care. So nowhere on that list is anything about your sexuality or how nice the home is that you live in or anything like that. It really is more about, are you able to safely support a child in placement? So a few questions about your home. Do I need to have a spare room? Very simple answer to that one. Yes, you do. There's lots of nuanced and varied reasons why, but at the end of the day, it really helps children in care to feel safe and secure in your home and in your family, and it helps them to feel that they belong because they have a place in your home that's theirs. So that's why it's really important. Do I have to own my own home to be a foster carer? No, thankfully, because we probably run out of foster carers very quickly with the way things are going in Melbourne at the moment with home ownership. So you don't need to own your own home. Really, all we need to know is that the home that you're living in is safe and suitable to foster. So you might rent or be in public housing or have a mortgage or own your home outright. Lucky you if that's the case. You might live in an apartment or a house. Really, the only thing that's important to just note here is if you do rent or you're in public housing, you might need to seek approval to have an extra person in your home or people in your home when you're fostering. So that would be your responsibility to look into and just make sure that you're behaving within the rules of your tenancy agreement or your public housing agreement. So a little bit about your family. So can I have my own children and also be a foster carer? Absolutely, you can. Obviously, what we need to do is assess your family situation as part of that assessment process. So we will consider that when we're making decisions about the children that we would be placing with you in that assessment process. What we do at Life Without Barriers is we place children in your care who are younger than your youngest child. So if your youngest child is 7 years old, we're not going to show up at your doorstep with 16-year-old triplets and say, this sounds like a really good idea. We would like to place children who are younger than your youngest child because it allows carers to focus on each child and address their individual needs. What's really important is that whatever age your children are, they should be old enough to be able to tell you if things aren't working out once you do start fostering. So if you have very young children who aren't able to communicate that with you yet, we definitely encourage you to just postpone your application for a few years and think about coming back when they're a bit older. This is a question we get a lot. Will all my family be involved in the assessment process? So everyone who is part of your household is involved to some degree in the assessment process. So there's formal assessments like probity, so police checks and working with children checks, like I mentioned earlier. There's medical and referee checks as well. And then there's more informal assessments. So we sit and have discussions with you and your partner as applicants, and also with anyone who lives in your household as well. So if you've got children at home, our assessor might come in and ask them about how they feel about a child coming to live with you, how they feel about sharing their toys. That's always a very interesting conversation to have with the children of the household, very cute. How they feel about sharing mum or dad's time with another child, and what routines or consequences or discipline are there in the house. And don't worry, we don't sit down and shine a bright light in their eyes and run the Spanish Inquisition with your children. We're very age appropriate. So if you have younger children, we might ask them to draw a picture of the family home and ask them things like, what do you love about living here? So we're always very sensitive about that. The purpose, I suppose, why do we talk to everyone in the household is because we have a duty of care to make sure that not only you, the applicant, but also the people who live in your home are prepared for the significant change that foster care can bring to their household. So that's what we're really doing in that assessment process. So some questions about the child in care. how are children matched to foster carers? So as I've mentioned about 20 times throughout this presentation tonight, we do complete a thorough assessment of yourself and your family and your household to make recommendations about what ages and needs level of children you should be caring for. So we've got all of that information about you and your family and your home. And then we receive information about a child who needs a placement. So we look at all the information we have about the child. We look at all the information we have about you and your family and any other available carers we have as well. And then we make a decision after we've done that about which is the most compatible match for the child. And that's how placements are made. This is an interesting one. Can I choose the age and gender of the child that I'm going to foster? So to a degree, yes, you can. So throughout the assessment process, we sort of chat about, which age and maybe gender might work best for you and for your family. Some people really don't have a preference. They're open to all ages, they're open to all genders, and others sometimes can have a particular preference about age or gender, most often because of their own experience. So it's what they feel comfortable with, and that's perfectly fine. I suppose the caveat there that I would add is that if you have really strict or rigid preferences about the age and gender of a child that you can care for, it may mean that you're not available to care for very many children. So if you're coming in and you're saying, I can only care for children who are aged between 4 and 5, and they can only be boys, and they have to be blonde, and they have to have blue eyes, we as an agency have to decide, are we ever going to be able to place with you? Is it worth our while conducting this assessment and bringing you to accreditation if it's that narrow and that rigid, the children that you would care for? So that's probably the advice that I'd give there. It's about having a degree of flexibility. So some more questions about the children in care. This one surprises people often, I think. So do children in care have ongoing relationships with their biological family? They do. Where it is safe and appropriate, that is absolutely an important part of foster care. So parents and family members of children in foster care love those children very much, and they want them to do well and to be okay. And they also have really important information about the child and their young life that carers and the child's care team needs to know. So where it's safe and appropriate, it is a really important part of the foster carer role that you are helping children to remain connected with their biological families and keep those relationships strong. And I say very emphatically there, where it's safe and appropriate. And those assessments and decisions are made long before carers are ever asked to support that. So what happens if the placement isn't working out? Really a worst case scenario, I suppose. If things aren't going well, I suppose the important thing to consider is that it's not in the child's best interests for them to be constantly moved and shuffled from placement to placement because things aren't working out. What happens when that occurs is children start to develop this idea that there's something wrong with them and it must be them that's the problem if placements continue to not work out and they're being rejected all the time in their mind. So there's lots of different supports that we offer to foster carers and their families to try and make placements work and to support foster carers when things get tough. You'll have a care team wrapped around you who can have sort of open discussions and support you. There's training as well that's available if it's a particular issue that training might support you with. Sometimes we'll just try and get you to consider things from a different perspective or to take some self-care time for yourself so that you're in your best thinking brain. But at the end of the day, if a placement's going disastrously badly for you and for your family and for the child, all we want to do is work with you to find the best solution for you and for your family and for the child and make sure that everyone is kept safe. So that's a little bit about that worst case scenario, what happens when things don't go well. So some questions now about the process, that assessment process I keep mentioning throughout this presentation. So how long does it take? That's probably the number one question we get when people do make an inquiry. So obviously, if you're thinking about being a foster carer, you will have lots of questions for us. And obviously, as the agency assessing you, we will have lots of questions for you. So it's really important that we each get all our questions answered. So I guess from end to end, the application and assessment process takes about 4 months. So that is, if you tonight submitted an inquiry, hooray, at the end of this information session, you could find, if there's no major sort of blockades, in about 4 months' time, you could be accredited and out caring for children, which is very exciting. So that's about how long it takes. It allows you time to reflect, find answers to your questions, and really make a good informed decision about proceeding. So let's talk about the stages of the assessment process. There are 6 stages. The first one is making an initial inquiry. So that might happen at the end of this evening if you're feeling really pumped and think, yes, I'm going to go ahead and do this. And that's really about that eligibility piece and identifying if being a carer is right for you. And then there is a home visit, which is quite ironically named because it's not legal for us to be in anyone else's homes at the moment in Victoria, of course. So that is done via Zoom at the moment. And the lovely Louise, who you met at the beginning of this evening, is the one who will conduct that with you. Then you will complete some paperwork. That's always everyone's favourite part. So that's things like those police checks that we were mentioning earlier, things like that, an application form, nothing too life-changing. Then you do the fun part, in my mind. You step into training. So there's some really wonderful training that's offered to foster carers. It's obviously free, and it really walks you through the process of being a carer and what the expectations will be of you when you become a foster carer. What are some of the challenges you can expect to face, and what are some of the rewards you can look forward to? So really wonderful training that goes into lots of detail. It's 8 modules of training, and at the moment that's happening on Zoom as well, on weekends and evenings as well. It takes about 2 weeks to complete. Once you've done your training, if you decide, yes, I'm still pumped and I still want to proceed, then you will go into the assessment process, which consists of a minimum of 4 interviews with yourself, and we'll talk to your family as well throughout that time. So that's what the assessment process really looks like. Once we've done all of these things and talked to your family lots and lots, and you lots and lots, then we write it all up into a big comprehensive report, which you read and approve. And then we take that report along to what's called an accreditation panel for carers. And we and the Child Protection Department sit down and talk about how wonderful you and your family are and what great carers you're going to make. And everyone gets very excited, and we approve you to be a carer. So that's end to end what the process really looks like. And that's why you can see with all those steps, it does take about 4 months. So if you go through all of those things and you become a foster carer at the end of it, what can you expect to receive in terms of support? So it's important that you know that foster carers are never left alone in their journey at Life Without Barriers. There's always a team here to support you. It can be really challenging in a lot of different ways being a carer, trying to understand the things that children have gone through and the way that they're presenting in your home. Those things can be very challenging. And so it's important that you are supported and confident in your role. And what we know is that well-supported, confident carers provide excellent quality of care. So that's what we're all about. So these are some of the types of support that you can expect to receive. So there's always opportunities for training for carers to continue building your confidence and skills. There's specialist support, so things like therapeutic specialists or clinicians that you can access. There is a 24/7 on-call support. So if things start to go pear-shaped and it's 2 a.m, it's okay. There's someone at the end of the phone that you can call, and it's not someone off in a different state. It's one of our team here in Victoria who will probably know you and will probably know the child that you have in your care, so they'll be able to really support you. You're entitled to respite care, which we talked about before. So if you ever have a full-time placement with you, you are able to access that respite care for yourself to get a bit of a break. There is some financial support, and I emphasize the word some there. It's not a lot, and it certainly is not intended as an income for carers. It is to meet the day-to-day needs of children. So that's things like buying them clothes, making sure there's food in the house. That's what that financial support goes towards. And there are opportunities for networking with other carers, which I think is something that carers get really excited about. We really encourage those supportive peer-to-peer relationships for foster carers at Life Without Barriers. It's something I'm very passionate about. So that's something we're working on very hard. So that brings me to the end of the very long slides that I've been reading to you from. So hopefully that's been informative. And what I'll do now is just throw to Louise to just let me know if there's some questions in the chat box that I can answer.
No questions, Hannah, at all. You've obviously answered all our questions through the session this evening.
Wonderful. That's really good to hear. And obviously, as I mentioned earlier, if you do have some questions but you'd rather ask them in private, that's perfectly okay, and we respect that. So I'll give you some options now. for how you can have those more private conversations and continue the conversation after tonight. So we hope that this tonight is the first of many conversations that you'll have with us at Life Without Barriers about becoming a foster carer. So there's a couple of different ways that you can continue to find out information and keep chatting with us. So the first is to head to our website. So that is where you can find all of those wonderful stories that I was talking about before of some of our foster carers and some of the children who've grown up and are now adults and have aged out of care with Life Without Barriers. You can take a minute after this session, and it is literally no more than a minute to fill this form in. It's called the Call Me Back form. And what happens is that submits into, it seems like the ether, but it does go to one of our team and they will give you a call back in the next couple of days. So Lou is just popping the Call Me Back form link into the chat box. So feel free to click on that link and it will take you straight through to the Call Me Back form. And it's a very easy one to fill in. The other thing that you might do, if you're not patient enough, if you're a bit like me and you don't want to wait for that call back, that is totally fine and you can contact us instead. So the number and email address that you can do that are listed here on this slide, but they're also very visible at our website at lwb.org.au as well. So you might choose to go along there. So that really brings us to the close tonight in terms of all the formal information that I had to share with you. So I do really want to thank you and acknowledge the time and commitment that you have already demonstrated just by being here with us. And I really do appreciate that my voice is not the easiest to listen to for this amount of time. So I thank you for sticking around. I hope that you have found some information that helps you make the decision for yourself and your family about whether this is a good idea for you. Before I take us through to the final slide, I'll just do a last minute check with Lou. Are there any last minute questions that have popped into the chat box?
Yes, there is, Hannah.
Always.
Both me and my partner work full time. Can we still foster? And the same question. So, do children get placed with people who live in their local area, or can they be placed anywhere in the state?
Oh, it's a great question. So 2 questions there. Number one, if you both work full time, you absolutely can still be foster carers. So definitely more and more we're finding that it is kind of professionals who are applying who do need to work full time. So what we need to understand is what's your capacity and do you have any flexibility to support a child in care, and what are the care types that you're applying for as well. So that's all just part of the assessment, and those conversations will be had with you, but absolutely you can definitely be foster carers. And the question about whether children are placed within their local area is a really good one. So what we do is we try always to place children as close as possible. So for example, we wouldn't want to be placing a child with you when they go to school 3 hours away. That would be a little bit of a problematic placement, wouldn't it? So we always try and place children as close as possible within the area. However, sometimes that's not possible. So sometimes you do find that there's a bit of a child who might be asked to place with you when there might be sort of a half hour or 40-minute drive to and from school. But don't worry, it's not always the expectation that you'll do all of that driving. There are supports available for foster carers where we know that those placements are being made a little bit further away. So hopefully that's answered your question, but certainly if you're living all the way over in Melbourne's western suburbs, you won't have a child placed with you who goes to school down on the Mornington Peninsula. That's not what we try and do.
I have a couple more as well, Hannah.
Yeah, great.
I am 66. Is that too old to foster?
No, it is not. 66 is a ripe young age, and you should absolutely consider popping in an application. So as I mentioned throughout the presentation this evening, all we really need to see is that you are fit and well, whatever age you are. We just need to make sure that you're fit and well and able to cope with the demands of care. So 66 sounds like the perfect age to be applying to me. Absolutely.
And can we ask for siblings to be placed with us so they don't get split up?
Yes, you can. And that is something that's music to our ears. So obviously for lots of very valid reasons, many people aren't able to offer sibling placements, often because they're living in inner city, apartments or homes that don't have enough space, for example. But if you are passionate about keeping siblings together, you'll be very popular with our team, because that's something that we're always looking for, is options and opportunities to keep siblings under the same roof where we can. So absolutely, please make that clear.
And I have another one. How long are placements usually for?
Oh, that's a really good question, and probably really hard to answer. I think, as we talked about a little bit earlier, there's all of those different care types. So every day around Melbourne, we're receiving referrals for short-term care, long-term care, emergency care. So it really depends on the day to day or week to week. Sometimes we get lots of long-term care referrals come through. Sometimes it's all emergency referrals, and that's all that's needed. So it really depends on what's going on.
And another one for you. Do the children like to be in family environments with other children, or does that not matter?
That's a great question. And again, that would be totally dependent on the child. So some children love going to placements where it's just them and adults, and they get lots of attention and lots of affection, and they really get that one-on-one time, that special time with the adults of the household. Other children absolutely thrive where there's other children around. So it's a totally individual sort of answer to that question. But that's why we need foster carers, some who have children, some who don't. We really are interested in diversity in our foster carer pool so that we're able to offer the right kinds of placements for the children who need them.
And a couple more, Hannah. If we take siblings, can they stay in the same room together?
Great question. They can often share the same room, not always though. So again, really depends on the needs of those children and maybe what they've been through. For example, if one of them gets horrible night terrors and can be thrashing around and screaming in the nighttime, that might be really scary for their sibling to stay in the same room as them. So for reasons like that, sometimes children do need to have their own separate bedrooms, but all of that will be known in referrals when the placement option is put to you. So you'll be able to make those decisions about accepting the placement or not.
Excellent. And children need their own rooms. Aside from a bed, is there furniture which also must be provided, i.e. a desk, anything else?
Yeah, really good question. That's someone really thinking about the practicalities of becoming a carer. I love hearing those ones. There's no sort of mandatory list that we require you to go off and buy at Amart Furniture or anything like that. The bed is absolutely, or the cot is absolutely what we're interested in. We want to make sure that we have sleeping arrangements sorted for the child. What can be really nice is actually having not too much set up in a room so that when children arrive into placement with you, you can say to them, what would you like to do with your room? How would you like to decorate it? Would you like a desk in here or would you prefer a beanbag? That can be a really fun way to start the placement with the child. And then they get a sense of ownership and that they, this is their room and their space. So that's something you might like to consider as well. But there's absolutely no sort of minimum requirement. We need to have a bed and somewhere safe for them to store their belongings. But other than that, the room is up to you and the child.
And that's all from me, Hannah.
Lovely. Oh, some really good questions there.
Oh,
thank you, guys.
More, sorry.
There's always one more.
I know how easy it is to get attached to a child and vice versa, especially when it's a difficult home situation. Is it covered in the training on how to deal with the attachments?
Yes, it is to a degree covered in the training about how to cope with placements ending. And it's something I think no matter how experienced you get as a carer, your heart will always be a little bit broken when placements end. And that's something that, because you have a big heart, you're offering your home and your heart to a child. That's something that sort of comes with the territory, but you absolutely receive lots of training and lots of support around that issue because we know it's something that can be challenging for carers. So it's important that you're already recognising that that's a reality that you will be dealing with in foster care. So that's a really good sign that you're already aware of it and you'll continue to be supported around that throughout the whole process.
Yeah, and I have another great one, Hannah. Do LWB have contacts to buy or and get second-hand furniture from?
Oh, that is a good question. I can't say that we have sort of really well-established contacts where I can promise everyone here a car and a bed or anything like that. Depending on the particular placement that might be being made with you, if there are particular demands that are needed, for example, a good one is bunk beds. If it is a sibling placement being put in and you do need to rustle up some bunk beds with very short notice, we can absolutely work with you to try and source some of those. I suppose that comes after you're accredited. So if it's a particular placement we're talking about, we can work with you on that. Before accreditation, it is an expectation that you will have, that appropriate bedroom set up for the child and ready to go. Hopefully that answers.
I always suggest as well to go maybe looking at the garage sales, because a lot of people sell those things there, don't they? The garages.
That's right. And Facebook Marketplace. I cannot tell you how much wonderful furniture some of our carers have purchased on Facebook Marketplace. It's a treasure trove. So, and that's something you can talk with your assessor or with Louise about. If you have concerns about, am I going to be able to afford furniture and things like that, please talk with us about that. And we're always very happy to listen and to help.
Yeah. And another question, Hannah, do some children get to stay with you until they are grown up and want to move out independently?
Yes, that's a fairy tale ending that can happen for our foster care families. So we have lots of children placed with us at Life Without Barriers at the moment who are approaching the grand old age of 18, and the plan is for them to stay with their foster carers, which is just wonderful when that's the case. Sometimes the fairy tale endings aren't what you would expect. Sometimes the fairy tale ending is the child going back to living with their mum and dad and then being happily reunited, and you get to be a part of that as a foster carer. You get to help put that family back together. So sometimes there's lots of different ways that you can feel the win or the reward in foster care.
And another good question, Hannah. If children need computers or other electrical items for school, is the cost reimbursed?
Yeah, so that's something that carer allowance can contribute towards. And if it's a really significant upfront cost, absolutely always talk to the care team about that, and we will advocate for some support for you. So sometimes there's an expectation that carers might contribute to part of the cost, but certainly if it's a really big cost, there's no expectation you'll be digging into your own pocket to meet, those kinds of unexpected costs as well.
Excellent. Great questions.
All. Yeah, really good questions. Thank you. I love getting some questions at the end of the presentation. It shows people are actually there and haven't gone to sleep while I've been talking, so that's promising. So I will end it there, guys. Thank you so much again. And thank you, Lou. I really appreciate you being here to help me man the chat box.
No worries. I have put that link in there for you all also. So
excellent.
Click on the link.
Yep, so that Call Me Back link is there in the chat. So please do click on there and fill in a form if you would like to hear from us in the next few days. To finish us off tonight, I like to end on this slide with the lovely Stacey, who, if you remember throughout the presentation, grew up in foster care and is now studying to be a social worker. And I just love this quote that Stacey has: "Without my carer, I wouldn't be where I am today." And I think that's a really important key message for you all to take home in your pockets. That is the impact that you can have on children and young people's lives by coming in to be a foster carer. So we do hope that you are in a position to make that commitment, and we really look forward to continuing the conversation with you if you choose to proceed. So thank you very much, everyone. Really appreciate your time and being here, and we hope to chat with you again soon. Thanks so much. Bye.